Imagine you're in a hospital needing urgent medical care, but every word the doctor says is unintelligible, a stirring of sounds that carry no meaning. Your heart races not only with concern for your health, but also with the helplessness of being unable to communicate your pain. For many non English speaking immigrants, this isn't just a scenario, it's a reality they face in our healthcare system every day. This isn't an isolated experience, it's the reality for millions in the United States with limited English proficiency. These individuals face delays in care, increased risk of misdiagnosis, and poor health outcomes simply because they can't speak the right language. Hi, my name is Isabella Rodriguez, and welcome to my TED Talk. Today, I'll be discussing the impact of language barriers in healthcare. As an immigrant, I've personally experienced how linguistic challenges affect various aspects of life. And so, because of that, I want to bring attention to the largely overlooked issue of how language barriers deepen inequities. To really understand linguistic inequities, it's important to start with the understanding of what structural determinants of health are. So these are broad social, economic, political systems that shape how power, resources, and opportunities are distributed. They influence the conditions people live in, like where they're born, how they grow up, and the environment that they live and work in. So these big picture factors set the stage for more specific things like the access to housing, education, and income. Linguistic barriers can be seen as um, a structural determinant of health as they are because they affect people's abilities to access essential services like healthcare, education, and social support. So for a long time, US healthcare policies have focused on English speakers, leaving behind the needs of communities that speak other languages. To this point, we can sort of say that linguistic inequities didn't arise in a vacuum. They are deeply rooted in historical and structural forces shaped by globalization, systemic racism, and inequitable policy framework, all of which I'll go into as the TED Talk goes on. So, as globalization intensified, healthcare systems in the US faced growing linguistic diversities but failed to adapt meaningfully. So, instead of embracing the multilingual inclusivity, the system prioritized assimilation into the dominant English speaking culture, reflecting patterns of white supremacy embedded into public policy. Title VI of the Civil Rights Act of 1964, which prohibits discrimination on the basis of national origin, requires federally funded institutions to provide language access. Similarly, Section 1557 of the Affordable Care Act expanded these protections by explicitly addressing language barriers in healthcare. However, inconsistent enforcement and inadequate funding have left these mandates largely symbolic, perpetuating systemic neglect. Globalization, what I was speaking about earlier, has further complicated this landscape. While it has deepened linguistic diversity, it has also deepened economic and cultural inequities, reinforcing hierarchies that marginalize non English speaking communities. White supremacy also plays a critical role in these dynamics as it upholds English as the dominant language and standard of care, effectively sidelining participants or patients, who communicate in other languages. So these structural factors have created what some scholars call a linguistic layer of oppression, where language barriers intersect with systemic issues like poverty, healthcare, inaccessibility, and racial inequities. So, the combination of the three of globalization, under reinforced legislation, and structural racism has entrenched linguistic inequities, leaving millions of patients to navigate a healthcare system that disregards their needs and perpetuates their marginalization. I want you all to think about, and I implore you all to think about the cost of linguistic inequities and the human cost of it and how devastating it is. So, patients with limited English proficiency describe feeling invisible, powerless, and alienated. So, imagine the heartbreak of watching your child suffer because you can't understand the doctor's instructions or being too scared to call 911 because you fear a language based misunderstanding. I would like to say that healthcare is not just a service, but it's a lifeline. When that lifeline is severed by language, the results are measured not just in statistics, but in lives lost and communities fractured. The emotional toll reverberates through families and neighborhoods, deepening mistrust in healthcare systems and widening health disparities. So, what's being done to address this, you may ask? Well, there's community led programs like Hablamos Juntos, which was initiated by UCLA. And initiative trains bilingual community healthcare workers to serve more than just translators for their communities because they serve as translators in different healthcare offices, but they also become advocates and educators um, and sort of help bridge the cultural divide in their communities. The U.S. Department of Health and Human Services also supports these efforts by providing e learning programs and culturally competent um, nursing care, as well as self directed training courses for all types of healthcare workers. So these resources aim to equip providers with the skills to navigate cultural and linguistic diversity effectively. Patient advocacy also plays another crucial role. So, specifically, um, the nonprofit organization like the Patient Advocate Foundation offers free case management services in various languages to support patients with chronic conditions and debilitating illnesses. However, despite promising interventions, many of these still fall short due to systemic challenges. Community health programs, while excellent, often face the chronic problem of being underfunded and having limited resources. So, this sort of restricts their reach and their impact. In the same vein, interpreter services, while essential in high-stake medical interactions, are inconsistently available, and even when they are provided, they are frequently rushed or insufficiently integrated into the patient experience. So these efforts, while valuable, highlight the urgent need for broader implementation, systemic support, and sustainable funding to truly dismantle linguistic barriers in healthcare. So, how do we create a healthcare system where language is no longer a barrier? Well, one way to do this is to work with what we already have. So, a way to think of this is through policy reform. Policies like Title VI and Section 1557 of the Affordable Care Act um, can have a real impact, but the enforcement mechanisms must be strengthened. So, this includes mandatory audits of healthcare facilities for compliance with language access and financial penalties for noncompliance. Government should also establish dedicated grants to fund on-site interpreters, mobile interpreter units, and should really enforce hiring of bilingual healthcare professionals, particularly in underdeserved areas. We could also implement workforce training. So, cultural humility should become a mandatory part of medical education and professional development, sort of emphasizing the need to recognize and address unconscious biases. We could also expand community solutions like Hablamos Juntos by funding community healthcare worker initiatives where bilingual individuals are trained to navigate healthcare system alongside their patients. This would sort of look like establishing partnerships with local organizations like faith groups, cultural centers, and schools to host regular workshops in patients' native languages. So these programs should also or could also include culturally tailored health education on topics like preventative care, chronic disease management, navigating insurance systems, and all of these things would be delivered by representatives of the community. Having all this in mind, I would like to most importantly say that healthcare is not just an issue, or this is not just a healthcare issue. It's a fundamental human rights issue. So every person, no matter what language they speak, has the right to be heard, understood, and treated with dignity and care. But meaningful change doesn't happen on its own, and it demands collective action. So together we must push for stronger language equity policies that ensure that nobody is left behind. We must support organizations that uplift and empower marginalized communities, giving them the tools to thrive as well. And I think most easily, we must educate ourselves as English speakers and others to break down linguistic biases and foster a culture of inclusivity and respect. The responsibility is ours to create a world where language is no longer a barrier to care, but a bridge to equity and understanding. Healthcare is more than just a service. It's a promise of dignity, a promise of care, and a promise of hope that everybody deserves, regardless of what language they speak. Yet, for far too many, that promise is broken at the first word. Language should never decide who gets the care they need or whose life holds more value. It should never stand as a barrier to compassion, understanding, or healing. Healthcare is meant to be a universal right, not a privilege tied to the language that you speak. Together, we have the power to change this. We can break these barriers, amplify unheard voices, and create a future where every person is seen, heard, and valued. So I encourage you all to build a system where language is not an obstacle, but a bridge to equity, dignity, and hope. Thank you so much for coming to my TED Talk.